if I noticed some pigmentation on my face, for example, and maybe it wasn't going away, and I thought, yeah, I'll check this out and go along to my GP. Can you tell me what my journey is likely to be like? What should I expect?
So first of all would be a medical history being taken. The next thing would be they would be examined properly. Now, first of all, that would be with the naked eye. So your GP or dermatologist would look at you with their naked eye to begin with. Many GP practices, and certainly most dermatologists, would have a magnifying glass called a dermatoscope. So it's a very fancy magnifying glass that has different wavelengths of light within there. So they would have a look with that. And in some practices, so if you were to see me or many dermatologists, we'd have something called a wood lamp, which is an ultraviolet lamp. You'll often see it being used to detect counterfeit money. So you'll shine your banknotes under it to make sure it's genuine money. And I think they also use them to look at pet urine as well. But in this case, actually, it's very, very useful for looking at pigmentation to see exactly where it is in the skin. So that would be done as well. All of those are non-invasive. They're non-invasive, no needles involved, and hopefully within a few minutes of examining you, they'd be able to have a rough idea as to what was going on. It may well be, as well as examining, if, for example, you went with pigmentation on the face, they may ask to look elsewhere on the body, because sometimes you can get clues elsewhere on the body as to what the underlying cause for the pigmentation is, and then how best you can treat that. The other thing then, if they're not sure what, if somebody comes to me, they've got a patch of pigmentation or indeed any other skin disease, and you're not sure what it might be, you might be referred for what's called a skin biopsy. Now, skin biopsies are all done under local anaesthetic, so you're awake the entire time. And normally, the way dermatologists do them, so skin specialists like me, we would inject a local anaesthetic into the area of skin that we're taking the biopsy from. So that feels a little bit like a bee sting. Within 2 to 3 minutes, that should have had its effect. So after that, all you should feel is pushing and pulling. You shouldn't feel anything sharp after that point. They would normally then take a 4 millimeter punch biopsy, which is like a hole punch. That would just be inserted into the skin. That little circle of skin will be taken out. And then the hole that's left there in the skin will be sewed together with a couple of stitches, which would be removed normally after about 7 to 10 days. What would then happen to the actual sample itself is that would then be sent off to a lab, and it's then processed. It sometimes is embedded and has certain stains applied, and then looked at under a microscope by a specialized pathologist. So that's normally a doctor that is trained at looking at slides. So they're trained at looking at pieces of tissue, whether it's the skin or other parts of the body, and they look at that under a microscope to see if there are certain patterns there that indicate what this condition might be. That report then will go back to the doctor that requested the biopsy, and they'll look at that report, they'll tie it together with what they thought from when they examined you, and then they'd hopefully then be able to give you a diagnosis and a management plan. Now, sometimes people also, if it's a rarer condition, something like, for example, lupus, which is causing post-inflammatory hyperpigmentation, it might be that the doctor requests a series of blood tests as well. Again, that would involve a needle in the arm. It takes about 30 seconds, maybe a minute to do, and the blood samples are sent off to a local lab, and certain parameters are looked at to see if they can give a clue as to what the underlying diagnosis is and whether further treatment is needed as well.